Good afternoon, everyone, and thank you for joining us today. Last year at this time, iConnections hosted Fund for Foods as we just kicked off in the crisis, and we're realizing how many were in need at food pantries. It's hard to believe over a year later, we're still in this pandemic. And when we look at the amount of suffering that many of us have had, there's probably not one area that stands out more than mental health. So we wanted to really focus on that today. We have two CEOs with us who both spent their careers really focused on creating nonprofits to help those suffering from mental health issues. And we're going to hear today about some of the increased issues that have happened through the pandemic and how these nonprofits are focusing on helping people that are really suffering during this time. So I wanted to thank our two CEOs that we have with us today. John MacPhee from the JED Foundation, who has spent over 25 years of his career dedicated to the nonprofit world, and Gary Mendell, who started Shatterproof after a very tragic experience of losing his son to addiction. And Gary came out of the business world as an entrepreneur and really put his full efforts and heart behind creating and running Shatterproof to help other families. So thank you, gentlemen, for joining us today on this very serious topic. I'm a partner at Golden Tree Asset Management, and one of my roles there is leading the culture committee. And what I have seen from just hearing from our employees and families and nonprofits we support has just been an overwhelming sense of panic and anxiety and isolation during the last year. I'd love to really spend some time hearing from both of you about what your nonprofit is focused on and how you're serving that population. So maybe tell us a little bit about each of your foundations. John, we can start with you, and let's hear about the JED Foundation.
Sure. Thanks, Laurie. Thanks for inviting me. It's a pleasure to be here and to talk with you and with Gary. The JED Foundation is a nonprofit organization, as you said, and we're focused on protecting emotional health and preventing suicide for teenagers and young adults, so 13 to 30-year-olds. And we do that through educational campaigns and trainings and resources that are aimed at teens and young adults and the older adults around them. And our goal there is to strengthen attitudes and behaviors around mental health, self-care, seeking help when you're struggling, and giving help to noticing and giving help to others. And then what we also do, which is really the heart of what we do, is we work with schools. So we work with high schools and colleges because those are the real life systems that have so many teenagers and young adults. And we help them look at all their policies, programs, and systems and create a plan for how they can create a mental health safety net that is increasing protective factors like the development of life skills and social emotional skills and reducing stigma, promoting help seeking, all the way through to how do you notice if a student is struggling? How do you get them to mental health care? How do you make sure that's effective? All the way from there to making sure that crises are handled appropriately and that means safety is provided for. And what we mean by that is that access to potentially lethal means or suicidal means is restricted. So when we work with colleges, we literally check if closet rods break if somebody tries to hang themselves. And so we partner with schools for years and help them do this systems change work. JED is working now with 360 colleges in this way that represent about a fourth of the students in the country. And our high school program we launched this year and is growing quickly and is in dozens of schools. So that's the quick
Yes.
overview. You can think about the school's mental health systems change organization. Thank you.
Thanks. And Gary, you started Shatterproof after a tragedy in your family. Tell us a little bit about that and what Shatterproof is trying to do.
Sure. As you said, I was in the business world, and my older son Brian was struggling with addiction, and tragically we lost him after an 8-year battle. But in the months that followed, which is relevant to what we're doing, is I traveled the country really in the search of two questions. What could I have done differently as a father? And what could be done to spare other families of the tragedy my family had suffered? And after 3 months of traveling the country, my questions were answered in the sense that I learned that the United States federal government had provided grants of tens of billions of dollars to researchers all across the country in the decades prior to my son dying. And those researchers had successfully used that funding and created this wonderful body of knowledge that had proven through randomly controlled trials, had proven without any doubt that if communities do the following things, many less of our loved ones will ever develop the disease of addiction. And if treatment programs follow these certain protocols, those who did develop the disease would be treated with success rates much higher than those who didn't. Yet all this information was sitting in peer-reviewed medical journals, and hardly any of it was being implemented in our healthcare system and our communities. And I just, as a father, I was destroyed. But coming from a career in business, I saw an opportunity. It was the answer to my two questions. What should I have done differently as a father? I should have known this information. And two, all we needed to do when I ran models on if we implemented what the science already showed, we could cut the tragedy of this disease in half, and let NIH fund other things to end it. But if what this country needed, what our families needed, what people needed, was an organization to simply implement what we already knew. And that was the formation of Shatterproof, to prevent and treat this disease with the science that we already know without any shame or stigma, just like any other disease. What we're doing today is our work falls within three areas. We're leading an effort to transform the treatment system in the United States. We're leading an effort in this country to reduce the shame and stigma associated with this disease, with those afflicted with it and their families, and the medications that treat it. And we've developed educational modules that are very simple, 6 lessons of 5 minutes each, that are being distributed through numerous organizations throughout this country. That's only a year old at the educational models, but it's already up and running with great receptivity. As far as transforming the treatment system, that first area that I mentioned, there's 5 things. Unbelievably, for the treatment of addiction, there existed no national standard of care for the treatment of this disease. So we worked with the leading researchers who had drafted and published the Surgeon General's report in 2016. We documented and published a national standard of care for the treatment of addiction, which is already getting broad adoption across the country. With over 200 million people are now involved in being treated through these best practices. Number 2, we built a quality measurement system that gathers data about the treatment programs in the United States and shows transparently to families looking for treatment. You can compare side-by-side treatment programs, which ones are following which evidence-based practices and which ones aren't. We raised $5 million from philanthropy and built it and launched it last year in 6 states. We're about ready to announce in about 4 weeks, 4 more states that we're expanding into. And we're within hopefully a month of announcing an 11th state, one of the largest in the country. When we finalize these 11, we'll be in more than 40% of the US population in states representing over 40% of the US population with this quality measurement system.
That's great.
It's phenomenal, and it's getting such great reception from states and commercial payers and families. Our policy team is changing payment models across the country. The first one we're focused on is the collaborative care model, which has proven to significantly improve the outcomes of those being treated with Medicaid insurance, where it's being paid for by this payment model. Because it's not just paying a provider to do X, it's paying a team of people to do the wraparound services that are needed to treat someone the right way. We're also one of a few organizations leading through Congress right now, a bill that's in the House and the Senate with sponsors, it's had hearings, that would require every doctor in the country who has a DEA license to prescribe controlled substances, which is most doctors, to also get the basic education in the prevention and treatment of addiction. Not specialty care, but the basics. So that's transforming addiction treatment, and we're working in 25 states right now to get those billing codes adopted and implemented, as well as in Congress. We're working with a few organizations to get that bill through. One last note on ending stigma. We spent all of 2019 studying 11 movements in this country related to health that have been successful in changing the way that society thinks about a particular health issue. You know, in a recent poll, 80% of Americans want nothing to do with someone who's addicted to prescription opioids. And how does that make a person feel who's addicted? Are they going to seek treatment? 20% of those addicted will not, because they don't want anybody to know. And those who do get treated with great care still live in a society where they know most people don't want to do anything, have anything to do with them. You know, as a friend, a coworker, or neighbor. So are they going to, how are they going to feel? How do you feel when you've been properly treated and you have the potential to do well, and you feel horrible with low self-esteem because of all the touch points you get in society? The great news is we have a plan that has been proven through science, through research, that has worked for other social causes and mental health and mental illness, that will absolutely, no question, reduce the stigma of addiction. Our first big intervention is in the state of Pennsylvania, where we're 6 months into it. Pre and post surveys after 6 months, 20-point reduction, 10 to 20-point reductions on, depending on which thought process or question you're looking at. Enormous success. Looks like it's going to be extended. We're talking to other states. Huge success with this. And again, it's all based on what's worked for mental illness and other health issues.
So it's so fascinating. You both have mentioned stigma, and during the pandemic, you as someone that's just observing, I have heard more about mental health in the last year than I think collectively in my lifetime. And I have heard it voiced more from people who are sharing stories. And so certainly there seems like a daunting task to reduce stigma, but I'm getting the sense of some optimism from our conversation. So maybe, John, talk to me a little bit about how your foundation is addressing stigma and some of the challenges that face us, but maybe some of the pathways to success as well.
Sure. Yeah, well, I'll start. I totally agree with your comment, right? One of the silver linings from COVID and the pandemic is that it's been such a challenge, you know, for all of us as it relates to our emotional well-being and mental wellness, that it gives us an opportunity to break down stigma and to just have conversations about mental health and how we're doing. So it's a silver lining, an opportunity we need to capitalize on. At the JED Foundation, when we think about stigma, we're really purposeful about making sure we know we're defining it, right? And we're clear about what we mean. And so, you know, at its broadest, when we talk about it, we're talking about barriers to seeking help and barriers to giving help when you know someone else is struggling. And with the research that we've done with young people, those barriers include uncertainty about what to do, sort of second guessing yourself, fear about misstepping, you know, damaging a friendship. You don't want to get anybody in trouble, right? You don't trust the system, and embarrassment and shame, you know, and the classic stigmas. But it's more than those classic stigmas among the young. Their classic stigmas are a little bit lower, but there's a lot in this space of uncertainty and fear and not knowing where to go and not wanting others to get in trouble. So I'd start there and say, like, let's be really purposeful about what we mean, and really break it down and unpack it so that messaging and campaigns can go after each of those components of stigma, you know, and barriers to mental health care. So what do? We have big national campaigns. We have a campaign with Ad Council, which is called Seize the Awkward, which you can check out at seizetheawkward.com or .org, right? And it's
I like the name.
And actually, Yeah, it's so the key to it, the sort of insight was that there was so much focus on help seeking, so much messaging that said, listen, if you're struggling, it's brave, it's courageous to reach out. You don't have to be ashamed, right? Which is a very, very important message. But at the time, a few years ago, there was very little around this idea. If you are concerned about somebody else, you should check in with them. You should ask how they're doing. You should be a help giver, right? And so the idea behind Seize the Awkward is trying to create more of a help giving community and movement in terms of attitudes and behaviors. And similar to what Gary said, for the work that Shatterproof does, we track attitude and behavior changes and have seen large changes. Half the teens in the country are aware of the campaign, and those who are aware are far more likely to report behaviors of initiating conversations when they're worried about friends. We also do a lot around storytelling, featuring people who have lived experiences. And that's really critical, right? So that we're giving voice and centering people that have lived experience with mental illness and challenges, and telling their stories in multiple formats. It's really about effective communication. And Gary alluded to this, you know, a lot of the mental health messaging is coming from nonprofits. And there's a lot that nonprofits can learn from the business world. In the business world, you don't do a campaign until you've done thorough market research, really studied what works, right? And you track what you do. And in the nonprofit sector, where a lot of nonprofits don't have the money to do that, the campaigns are more intuitive, you know, or more sort of personal experience based and less actual hard market research based. And we put a lot of energy into, you know, being very purposeful and diligent about doing research and doing research with youth and having them involved in the design of campaigns, so that they will land as we want them to.
Great. Gary, anything you would add to that?
Sure. First of all, everything John said, it's like right on, right? It's many nonprofits, as John said, don't have the funding to do testing to see what's really working and what's not really working, and how do you tweak it to make it better. Obviously, Jed Foundation does, and that's wonderful, and we're doing the same thing. And we've learned through the research, we studied this for a year, you know, how were changes made in this country, the way our country thinks about HIV/AIDS, what things worked, what things didn't work, what worked, marriage equality, we studied that one. 20 years ago, you couldn't even join the Boy Scouts if you were gay, and now you can run for president. Well, they did a lot of things that worked. They also did a lot of things that didn't work. And we studied all that. And we studied 9 other movements. We had experts with 50 interviews with 50 experts, and we put together a plan to do so. What we learned really is specific to addiction, what will work is 3 categories of action items. 1 is educating, 2 is language change, and 3 is policy change. Educating has to be done in a certain way. And it has to be contact-based, which means someone looks like the 3 of us, says, hi, I work for XYZ company. I've been here for 10 years. My name is Gary, and I've been promoted 3 times. I have a family. I have 2 kids. I coach Little League on Tuesdays. I have family barbecues on Saturdays for my neighborhood, and I'm addicted to heroin. And this is what I look like. And this is the life that I live. And that is humanizing it. It's putting a face to it. And it's giving the impression to people watching that 30-second to 90-second video. This is what someone who looks like a heroine looks like. It's not somebody in a back alley sticking a needle in their arm. Another thing is, what's the message? We learned through this research that Shatterproof was doing it wrong. We were doing it intuitively, and it was wrong. We were messaging, because John mentioned intuitively, we were messaging that addiction is a disease. That doesn't matter. Half the public thinks it's a chronic illness, but 80% of the public will not associate with someone addicted as your friend, coworker, neighbor, or marrying into your family, which includes many who think it's a disease. No, the message should not be it's a disease. It's someone that looks like us. It's a treatable disease. It's a treatable disease. And that's the message that you need to get across, humanizing with a human face. So that's where we've moved this to. Language change, this is not intuitive. We have the research to back it up. You describe someone I can point to a study that was done a few years ago, 300 health professionals in one room, 300 health professionals across the hall, randomly put in each room. They were both told the same story. One story was about an addict. The other story was John, who's addicted to drugs. Then they were surveyed when they came out of the session. Those who heard a story about a quote unquote addict were more likely to say, let's get the person to the criminal justice system. Those who heard a story about John, who's addicted to drugs, no different than John, who's a diabetic, John, who has asthma, but John, who's addicted to drugs, it's John. He's not branded by his disease, more likely to get to the healthcare system. So changing language is another big part of what we're doing. And then obviously changing policies. So that's what our program is built upon. We're now piloting it, as I mentioned, in Pennsylvania. We're also now close to an agreement to pilot it in several hospitals. We want to expand it to media entertainment with how they write their articles. So many well-meaning journalists write a wonderful article about a family who lost a child, and they describe the child as an addict. And they're describing the child, that child, young adult, in the best possible way. You know, got hurt playing soccer, got prescribed Vicodin, which turned into heroin, didn't know that Vicodin was addictive. They're describing this person and their family in the best possible light, but they call them an addict. And that's just education. That's educating journalists. That's our next step. In addition to hospitals, starting to move into the provider system. It's all doable. This is simply, as I mentioned in my opening remarks, taking what we know and implementing it.
So it really can be a very powerful negative connotation based on language selection when it comes to this. And so you mentioned some of the pillars in education and some of the efforts that you all are trying to do. And we're in the middle of a pandemic. Hopefully, we're starting to see light at the end of the tunnel where, vaccinations, and that could also create a lot of stress and anxiety as we get back to, more of the norm. But talk to me a little bit about the JED Foundation and what happened during the pandemic. How were you forced to change directions? Because some of these initiatives that you're both talking about really seem to me like they're hands-on, boots on the ground. And so now you've got to try and do some of this stuff virtually, and the whole idea of connecting kind of goes out the window quickly during the pandemic. So John, what did you do differently to redirect the initiatives at JED Foundation?
Yeah, so a lot changed. First was just this uncertainty that everyone was dealing with, but as running a nonprofit, you have to deal with it too. What's going to happen to our funding? Do we have all the resources we need? Is that going to somehow change? So as the mental health crisis was getting worse and was, being affected by COVID, we had to keep an eye on that. We also disbanded our office, gave up our lease, so we became a virtual organization immediately. And in terms of our work, you're right, we are a boots on the ground organization. We go into schools, we do technical assistance, and all of that technical assistance had to become virtual. And so that was a big change. Also what happened, but it worked out well, actually. I guess I'll come back to that. But so we switched to virtual, and we also do live events and live training events, and that switched to virtual. But also the nature of our advising the schools changed. We typically do long-term systems change, right? Long-term thinking and planning and sustainable systems change. And a lot of it pivoted to, okay, what do we do with these students now that they're going home? And there's no village around them, right, to protect them and to notice if they're struggling. So we help schools think about, okay, how are you going to do telemental health? How are you going to set that up? How are we going to interact and talk to families, about how to support their children at home? And then teachers who had so much responsibility, right? They're the front line of needing to adapt and change. Well, they became really one of the only people in a position to notice if a student was struggling and do something about it. So we did a lot of training programs for teachers as well. We started running almost like support groups for people at schools, the administrators at schools and the mental health service providers at schools to come together. We would convene them and just have, just moderate discussions about what they were doing and how they were sharing ideas and and all of that. So there were a lot of changes. Now, the virtual model actually worked pretty well. And so going forward, I think we'll be in a mixed model, right? Because virtual allows us to scale faster. So we're going to find ourselves in some kind of a mixed model, and where we were planning to do maybe 40 live events last year, you know, and reach maybe 1,000 people in person. The virtual events we did instead, we did 200 of them and reached something like 50,000 people, right? So a huge difference. And so we're going to be mixed model. We're also, you know, we're leasing a new office. We're not going to stay a virtual organization, but we're going to be more flexible. And we're probably going to have regionally based people now all across the country, where we used to only be in New York. So there's a lot of changes that are happening at the JED Foundation because of this, a lot of learning that I think will make us a stronger organization as we go forward.
That's great to hear. You know, it certainly was an unexpected challenge thrown at us, but being able to pivot and thrive using technology is something that I think will be a lasting impact on all of us on a go forward, and especially as it relates to nonprofits, which are, you know, generally so cash strapped to begin with. Being able to leverage a larger audience and connectivity is fantastic to hear. Gary, what about yourself? You know, what are some of the things that you pivoted towards during the crisis to leverage off of people that needed support from Shatterproof?
Sure. First thing I want to just say, which I know John knows as well, all the right things to do to protect families from COVID make it so much worse for someone who's addicted or has a mental illness. The isolation, the social distancing. For those with a mental illness or a substance use disorder, it couldn't be worse, right? But you need to do that for COVID, to protect ourselves from COVID. And so that, in addition to the anxiety that came along with, am I going to lose my job, or I'm living alone, et cetera, although the anxiety of all that, I know in mental illness, but I don't know the numbers exactly, but I know there's a big rise in addiction. Overdose deaths are up 25% year over year. We're going to approach 100,000 people dying from an overdose this year.
100,000 people in 2021.
Correct. That's what we're going to, I mean, it'll be in the mid 90s in 2020 when the numbers are finally published, and it'll be probably approximately that number in 2021. And based on the trends that we're seeing, you know, that's a 25 to 30% increase. It was just 40,000 just 4 years ago. I mean, that's how much it's growing. So that's number one. Number two, related to how we're changing things and how we're adapting. Like John, we gave up our office space. We're 100% virtual. Like John, we will be picking up office space later this year, and we'll be a hybrid between virtual and physical, like many companies. Like John, like many companies and organizations, our fundraising events turned into virtual. That's not as engaging as going to a 5K where you have 3,000 or 4,000 people there and you can meet them and feel it and feel the energy. On the flip side, there's no tents, there's no permits, there's a lot lower cost. And we did a virtual walk. Instead of doing 7 cities, we did a virtual walk last September 26th where people walked, run, hike, bike in their neighborhoods. We had people in all 50 states and the UK and Canada forming teams and doing an event like that, socially distanced, in their neighborhood. So I suspect when we bring back the physical events, we'll keep the virtual because you're hitting everybody in the entire country. The other impacts to us, we launched our quality measurement system, as I mentioned, in 6 states. So people can compare treatment programs side to side. We were beginning in January and February as we approached the launching of that. We were talking to states to expand into. That stopped for 6 months because of COVID. We are going to announce 4 new states in about a month, but we could have announced 4 new states 9 months ago, 10 months ago, if it hadn't been for the delay caused by COVID. So it slowed our growth a little bit. But besides that, everything is working programmatically, virtually fine right now. And as the country opens up, we will open up with it because there's a lot of benefits to having people in person, and it will be a mixture. And, but like John and many other, we're about transformational change. We're about changing the way that addiction is prevented and treated in this country, which is not only saving thousands of lives this year, it'll grow to tens of thousands of lives every year, without us having to do anything going forward, because we've created the systematic change by policy reviews and the way this quality measurement system, once it's up and running and it's systematized, it's already changing the way that addiction will be treated for decades. I mean, I can see it in the states we're in. Providers are already changing what they're doing because they know that we're going to be showing transparently what they're doing. So it's already changing. Insurance companies are now grabbing our data to build their networks, so they have the higher quality providers in their networks, and they're knocking out the lower quality providers. It's already happening. So
That's great. It
phenomenal.
sounds like while there was maybe some slowdown to both of your foundations in terms of what you were able to, increase, that was temporary, and the hybrid model has benefited to be able to do more of an outreach. And you both seem very optimistic about kind of the reopening and things will be able to do there. I wonder, with the increase of addiction and issues with mental health, as we get out of the isolation period in the pandemic, are there certain themes that you're concerned about as we jump into a reopening that would impact somebody suffering with mental health that might not be obvious to us? Just like I think, it wasn't obvious to us during the initial phase of the pandemic how much suffering there would be. What about as we get out of it? What are some of the themes that we need to be careful about? John, you want to kick that off?
Yeah, so that's a really important question, because we do need to be concerned as we start to open up about some people. There are young people, not just young people. I keep focusing on young people because that's our mission, but this is true also more broadly, who struggle with anxiety, who actually have thrived at home. Young people that have struggled with school refusal behavior, those that have been bullied and don't feel that school is safe, have felt more safe at home. There are students, young people of color who are in predominantly white schools who have felt more comfortable at home and actually performed better academically at home. So we have to be careful about assuming that the return is going to be easy for everyone, for any of us, but there are groups of youth for whom the return is going to be difficult. There should be, and we're working with schools to make sure that they're thinking this through and have specific plans. I also want to say, on a population basis, there's been work done, and SAMHSA has summarized this well, SAMHSA being the Substance Abuse and Mental Health Services Administration of the U.S., on disasters, on things like hurricanes and wars, et cetera. And often there is a coming together that results in, it's very stressful, so anxiety, depression, right, et cetera, up. But suicide rates often go down in the near term, and then they go up in the longer term, right? Because recovery takes a long time. There's a temporary sense of solidarity that creates a connectedness and a belonging, and then that can dissipate. Now, COVID has been different, right? We've seen this huge increase in drug overdose deaths, as Gary has said, and I don't know that we can actually say that we came together in solidarity and community perfectly well, on a national level here. But I do think there's a note of caution in there that we should not assume that, if we're fortunate enough that things open up and they return to normal, that there won't be long-lasting, impacts around mental health. There likely will be.
And what do you think, Gary?
I would echo everything John said and really focus on one key point, which is for everyone, even those, like John mentioned, a student who used to be bullied in school, who's more comfortable at home, those type of situations. Clearly, we need to focus on that population, but that's a subset. The broader audience is those who did well in school. They love school. They were not bullied, but now they've been home for a year. That's the vast majority. And that majority, change is not easy for anyone. not going to be changed for John and I. I haven't traveled in a year. I got to start traveling again, which I love to do. I mean, I always loved traveling around the country, engaging people in our cause. But I've been at home for a year.
But now
So,
you have to take the elastic pants off and get back on the road.
yeah. Absolutely. But change for anyone creates stress. And for those with a mental illness or those with a substance use disorder, those two audiences in particular can be very harmful. And so we need to make sure that we're mindful of that and putting the support services around it and the thought and the thought about doing it in the right way. That's all.
And so, let's switch gears to really your CEO leadership titles. I'm on a few boards of nonprofits. I see the turnover. I see the thin staff. I mean, truly, workers of nonprofits are our heroes, and they dedicate their time and life for something they really have a passion about. And I wonder, as I sit in a leadership role for, a company, I see the burnout in some of our employees. How did you deal with that? Particularly because you had such a growing demand of people that needed your assistance during the crisis. And then you have your own staff who's going through, potential anxiety and stress in the home as well. Give us some insights into your leadership during this pandemic and how you were able to run a nonprofit and really kind of stay connected to your staff and your volunteers during this time. It must have been so challenging. Maybe John, kick us off with that.
Sure. Yeah. Well, thanks for the question. It has been significantly challenging. Our team, we have people who have gotten sick, who family members have gotten sick. They've lost loved ones. They're schooling their children at home, really just under difficult circumstances. And, the work we do, suicide prevention and working with schools, has been tougher during the pandemic, right? There's been more sort of stress in the system and stress from school. So it's been very hard. And then we disbanded and we were virtual. So, in terms of how I tried to approach it, and with the leadership team, what we call our operating committee at the JED Foundation, is first try really hard to create a sense of stability, and optimism and calmness, and letting everyone know that if you need to step away. So, we switched over to, unlimited vacation. Don't worry, step away. We'll fill in. Somebody else will have your back. We're all going to be up and down through this whole process. We did a lot of that, a lot of one-on-one check-ins. We have a wellness committee. I mean, a lot of touch points, among the team. But I would say the thing that I aimed to do first and foremost was, one, I worked extremely hard on fundraising because we couldn't do our annual event, and I wasn't sure what was going to happen with earned income, to just make sure no one was going to lose their jobs, everyone was secure. As soon as I knew that was true, making that clear so people felt that sense of security, and stability. And that's the space, just sort of a really sort of caring environment, where everybody knows their back is covered if they have to step away for any reason in the middle of this.
And John, so 2 questions for you. How many employees does the JED Foundation have? And when did you implement that time away? Did you do that early on? Was that something that kind of came later in the crisis?
We implemented it right away. We have about 45 employees, and actually we hired something like 10 people during the pandemic because we were growing. The demand that's coming at us is higher than ever, because schools need help. So that also has been difficult, hiring people that you don't meet in person, onboarding them, creating that culture. And so we really, have worked really hard, to tend to that too, to help people feel welcome, as we're growing during COVID. We made that decision right off the bat too, that unlimited time, do what you need to do, just be a clear communicator about it so we can figure out how to cover it, the rest of us. But we also made an early decision that we were going to meet the moment. We knew that our work was going to be in more demand. So instead of slowing down, we actually stepped into it and we grew and did more work. And that actually put more pressure on our staff. So, both things were happening at the same time. We were trying to be really, tending to our staff, but I, as the CEO, was putting more work on them at the same time, and just, trying to balance that.
It's fascinating hiring during during COVID, right? And not virtually interviewing people and not being able to meet them. It was a very interesting experience, but there's so many people that used this crisis to really think and reflect about what they were doing in their lives and switch careers. And so you saw some really amazingly talented people kind of come through the candidate pool, and I'm glad to hear you were able to hire so many on your team. Gary, what about yourself? How did you kind of lead through this, and what are some of the things that impacted the foundation that you had to change through your leadership style?
Sure. A lot of similarities. We made a decision we made some changes right away. We let go 2 people that were related to the physical events because we couldn't see them happening in 2020 or maybe even 2021. We immediately canceled our 7 physical walks because they take 9 months of planning, and we couldn't be sure, so we canceled them and started making plans right away for a virtual. Similar numbers. We have about 34 people, but we added 6 during the pandemic because our quality measurement system was being launched. It was already in development and was heading toward a launch. And now that we're adding 4 more states at a minimum and probably more, we're already beginning to staff up for that, to gear up for that. And then the Stigma initiative grew we were already, again, all the work was done in 2019. We published in June, early June, our report on our business plan of how we plan to implement reducing stigma around this country. And that was already in the works. The report was almost done. We published it, and we immediately connected with the state of Pennsylvania to be our first big pilot, where we did surveys up front as a baseline. Everything we do is research-based. Here's our plan based on research. Here's a survey. We're going to measure it 6 months. We're going to measure it a year and show the results. That was already in the works. It took a little longer. Instead of conversations finalized in 2 months, it took 8 months, but it happened, and we're up and running. And we added people to accommodate those 2 programs.
That's great. So, kind of maybe thinking about the optimism of going forward. And as business leaders, you always have a go forward plan. So John, tell me what the go forward plan is for the JED Foundation in the next 3 to 5 years. What does the foundation look like? What are some of the new initiatives, and where do you hope to be in terms of serving this population?
Yeah. So actually, one of the things we did do during COVID was we created a new 5-year plan. We took the opportunity to do that. And so our goals are to help substantially more schools. So we work with 360 colleges. In the next 5 years, that number will be over 1,200, with more than half the college students in the country attending a JED campus. We launched our high school program just the first quarter of this year, and we will also serve over 1,200 high schools across the country within the next 5 years. So the core is really massive scaling of our schools work nationwide. We'll increase our campaigns. We're going to create a government and advocacy function. We've been playing around a little bit in that space. We're going to create a formal function because we think that there's just great work that can be done related to schools' mental health that isn't being focused on right now, and that we can have a significant impact in that regard. So when we look at our size, our funding, we're about a $10 million organization with 45 people. We should be a $17 or $18 million organization with about 80 people. Not growth for growth's sake, but that's what it takes to be really a national schools technical assistance program and scale these programs. So that's what we're aiming for. And by the end of 5 years, that's what we'll be.
That sounds like a solid 5-year plan to me. How about you, Gary?
A lot of similarities. We also have finalized, well, we always update every year our going forward 5-year plan. So we did it during COVID like we do it every year. And if you look at our 3 pillars of work in the transforming addiction treatment, there's really 2 big areas. One is our quality measurement system, and 2 is our public policy work. And our quality measurement system, with the 4 states that we're announcing shortly, and if we land the 5th state we're talking about, we'll be providing that resource to families in 40% of the US population. Our 5-year goal is to have that at 90%. Because we won't get 100%. I know a few states that won't do it. So that's quality measurement system. To get to 90% within 5 years. And again, we should be at 40% by first quarter of next year. So that's the quality measurement system. Assuming this bill passes Congress, then every medical professional in this country who has a DEA license for prescribing controlled substances will be required to have continuing education courses, not on specialty care, but the basics in the prevention and treatment of addiction. The next step is to sequel that with every medical school and nursing school in this country having required coursework so you don't graduate with not only how the body works, but also how the mind works for mental illness and addiction. And we're working with the Biden administration right now to get a convening of the accrediting bodies to get that happening. So you don't get accredited as a medical school or a nursing school unless that's required. That's the 1-2 punch in professional education. Moving to stigma, we are creating a national stigma index, which will measure how this country views a variety of knowledge, attitude, and behaviors related to addiction, those afflicted with it, and the medications. We'll be launching that in the fall this year. We'll have a baseline, and the goal within 5 years is to move that down 10 points of how people view this disease or more, at a minimum 10 points. Education, there's 122 million families in this country, and we can track how many are going to our website in our Learn section versus in addition to that, those education modules that I mentioned. We're about 1% of the US population right now. We want to get that to 20% within 5 years and grow from there at a minimum. That's our metrics.
That's great. And so, iConnections, I think, has done such a phenomenal job of having these platforms for us to engage with an audience that's largely, financial industry audience and allocators, many of whom come from, state plans or endowments and foundations themselves that have grants. So maybe what would be helpful for maybe some folks listening that kind of sit in my seat is to just hear quickly how your foundations might work with corporate sponsors and maybe some of the needs that are addressed by these corporate sponsorships. So maybe John, kick us off on that.
Sure. So we work with corporate sponsors in a variety of ways. We sit down and we talk and we sort of look where the overlap is between our interests. So we have corporate sponsors who fund our work in schools, often geographical, like if there's a certain geography that's important to a school, we'll receive restricted grants, for specific programs, again, depending upon the interest. But then we'll do campaigns together. So we help corporations and organizations do campaigns that are employee facing or externally facing around emotional well-being and mental health. We've done that quite a bit. We train employees of corporations around how to support the teens and young adults in your life. And we've done a lot of that. And we've worked also with corporations around how they can think about supporting the emotional well-being and mental health of their young adult employees. So
the foundation will come into a corporate office and work with their team to really help kind of promote mental wellness within an organization.
We do. Now we put it through a filter of wanting to make sure that it's about young adults. So okay. It's really about employers that have a critical mass of young adults or older adults who have teens and young adults at home. Okay. And of course, that's true of, so many organizations. But yeah, we're very happy to do that and have done quite a lot of it.
That's great. And how about you, Gary? How are you working with your corporate sponsors?
Sure. There's really 5 ways to work with companies. One is, as John mentioned, to help their employees. So we often do webcasts for companies to help their employees. And we have this educational program that I mentioned. It's 6 lessons, 5 minutes each. We launched it a year ago with JP Chase for all 300,000 employees. It's slowed down a little bit with COVID, and now it's rising back up again quickly. Caesars Entertainment is doing, JP Chase, as I mentioned, Optum Health, Highmark Health, state of Pennsylvania. That'll be announced shortly. All their employees.
Hot off the press.
Thank you. One of the largest cities in the United States is going to be announcing it in 3 or 4 weeks for all all their city employees, one of the largest cities in the United States, KKR, McKinsey, Boston Consulting Group. It's spreading like crazy to companies. It's 6 lessons, 5 minutes each, very simple, and it's for all employees. So that's number one, to help employees of a company. Number two, we work with the marketing departments for sponsorships. We have our 5Ks, we have our events. So we work with the marketing departments for sponsorship of our events. Number three, their foundations. You know, I mentioned we raised $5 million to build that quality measurement system. Roughly, little over half of that came from Robert Wood Johnson and Arnold Foundation, but slightly less than half came from the foundations of the 6 largest health insurers in the United States to pilot that and get that up and running. And then every year, philanthropy as a percentage of the cost will come down as payers, because there's a return on investment of lowering healthcare costs and helping people, and same with states, are taking a larger and larger percentage. So that's an example of working with foundations. The other fourth area that we're in is workplace giving. Many companies allow their employees up to X, we will match dollar for dollar whatever you give to a charity. So we're deeply ingrained in that area as well with companies. The fifth area that we haven't got into yet, but we're exploring, is cause marketing, where a company uses their brand to market your brand to help get the word out about what you're doing. And that's the fifth area that we are exploring as we speak. And it's the last area, and it's very powerful to get that awareness out there among the public. If you have addiction in your family, here's where you can go for information. And we need to build that out much stronger than we have it now, and it's on our plan to do so.
That's wonderful. So it certainly seems like there's a lot of connectivity from firms like ourselves to be able to work in tandem with your nonprofits. So we talked a lot about the trials and tribulations of leading these nonprofits, the increased, workload, because of the pandemic, and some of your leadership skills that you've, probably strengthened through the pandemic, like most of us. I want to leave the audience on more of a triumph note. And so maybe let's end with, a story that you think represents your foundation in the most beautiful way. Maybe something that you were able to achieve, or a personal note of some triumph that we can leave the audience with. John, I'll kick it off to share the good news with you first.
Well, a triumph is when we hear stories, or it's reported back that when a culture of caring is implemented in a school, like how it works, right? So one of our schools in a young adult, told us a story about how actually she was thinking about hurting herself. She was intending to hurt herself, and she went to the parking garage and actually saw signs up that talked about the importance of reaching out for help if you were thinking that, which were part of our program and part of our work. And she actually stopped and called the number, and then had security, a caring, trained security person come and talk to her and walk her over to the counseling center and get her into care, right? And the counseling center immediately cared for her, and she's doing very, very well. And that was a story, and those kinds of stories about, because again, we're focused on systems, and they work, when we come together into a system where we're looking out for each other. And I just say, on a global basis, I am hopeful that this pandemic shows us how interconnected we all are, and that we come out of it sort of more caring, and in terms of looking out for each other and realizing our interdependence. I think that can happen, and it's just a tremendous, great opportunity for us all.
That certainly is a triumph. And if that young woman's listening, we're certainly so happy that you're with us today. And Gary, what about you? What do you think is kind of one of the standout stories for you? What do you consider triumph?
That's such a great question. I often tell people, and it's so true, that I know we're saving thousands of lives a year. And I know the systems change that we're creating will save tens of thousands of lives every year for generations to come. Having said that, there is no question, as much as I'm motivated by those numbers, there's nothing better than a personal story. And I'll just give you a couple. One, here's an email we received a few days ago. one of our relationship managers. Her name is Susan, the relationship manager. Dear Susan, thank you so much for responding to my request. On March 12th, my son died of an overdose back in 2014. He would have been 38 years old. I have been the nanny granny to his two beautiful girls, now 5 and 9 years old. He has left me a beautiful legacy for which I will be forever grateful. I am beyond words to describe the work of Shatterproof. Because I knew early on through what I learned through Al-Anon that this disease was about surrendering to a program to do better. However, I also learned how to separate this disease from the person among the other 100 other types of facts and truths. What I really want to say is because of Shatterproof, it is very possible and probable that my two granddaughters will not have to be embarrassed, ashamed, ostracized, or made fun of when the time comes for them to truly understand the cause of their father's death. The stigma, lies, myths will be gone because of you and all the people at Shatterproof that make this awesome nonprofit what it is. Please tell your staff not to give up, to be encouraged, that they are the future for my grandchildren. And she sent a picture.
Oh, so beautiful. And that makes it all the more powerful. You know, I keep notes right here of people that write for the charities that I'm on the board of. And it's really what keeps us going. It's what, you know, it's such a beautiful thing. And it's so great, Gary, that you had that to share with us, because I really think it allows people an inside look into the pain. And, you know, that grandmother wrote it so beautifully, what those children are going to grow up as. And they're going to grow up beautifully because of the work that you're doing at Shatterproof. And John, you've dedicated your life and career to doing in nonprofits and the Jed Foundation. So we really can't thank you enough for all of the work that you do and that your team does. And hopefully this was very helpful to the audience. If you're dealing with any of these issues, please reach out to one of these foundations and be inspired. And if you are not dealing with it, hopefully we've taught you a little bit more about some of the mental issues that people are suffering with now, and the growth of sensitivity that we all need to have around this to avoid the stigma. I want to thank you, John, Gary, for being on this conversation with us today. Thank you to iConnections for giving us the panel to have a voice. And thank you. We're blessed to have you in the world.
Well, thank you. Thank you so much. Thanks for your focus on mental health and addiction. Thank you.
Absolutely. Thank you, Laurie, for your focus as well. And John, nice to be reconnected. Wonderful.
Yeah,
Thank
you
you.
too, Gary.
Thank you.
Thanks.